recent case. So the purpose, so when it comes to children, you really need to put yourself in the children's shoes. When it has to do with anything, if they're scared or if they're angry or any emotion, you have to really think about what does that child think? And basically, when it comes to dentistry, you have to think about: do you remember when you were a child? Do you remember the first time you went to go to the dentist? Was anything strange to you? Did you feel comfortable? Did you feel uneasy? You got to think about those things. My research question was: how do factors related to the setting of a pediatric dental practice and communication strategies influence anxiety among pediatric patients? So the problem. So a survey was conducted among middle schoolers, 25 exactly, and between the ages of 7 and 14. This study documented that 60% of the children, they were kind of bothered by the equipment that was being used, the way it looked. They were kind of strange, the noises it made. 30% of the children were kind of bothered by, I don't want to say bothered, kind of anxious. This is a new place. This stranger's here, the dentist is a stranger. It's a new environment. And the other 10% were really not afraid. They felt indifferent towards, the whole thing. And these findings suggest that the children may not go to the dentist. May not go to the dentist to see they may not go to see the dentist frequently, which is also a problem. So especially for those kids that are anxious, if you have anxiety feelings, you're not going to be willing just to go there. You're not going to be, okay, I want to go there next month, or I want to go more than once annually. And this is a problem because this, which I also researched a little about, is about experiences that you have as a child. They follow you as a teenager to an adult, and if this is the case, so that means that these habits are being transferred and they're going through your life as you grow up. Does that mean that when you're an adult, you're going to be scared of going to the dentist? Maybe you are, but is that going to let you stop going to the dentist and being, caring about your dental health? The methods. So what I did was that, there was 25 children. They were from my own elementary school. And how I conducted this was by my siblings to go to that school. So what I did was, I asked them nicely if they could, distribute it between, the priority population that I had studied. And the reason why these children were chosen was to determine what makes people so anxious when they seek dental treatment. And these children were recruited by way of reaching out. My siblings, So I had a cover letter, and I had received all 25 cover letters, and I also had a bit where the parents had to read too, because, maybe, most likely these children might be able to fully understand. So I had the parents understand, put their signature on that too, allowing them to be a part of the survey. The survey was conducted towards children. The ages of the children were from 7 to 14. The gender would not be taken into account, and I chose this because I didn't feel that gender had a big part of it. I didn't feel like it had to do with girls are more scared about the dentist than boys, but I did find other research studies that did take this into account, and that's why I put this later into my presentation. There have been some studies that helped me with help me to think more outside of the box of just thinking about, these children are scared just because of their children and this is a new environment. It made me think about other things. Even the income has to do with it, and this is another study. Income has to do with it, race has to do with it, and it just opened my eyes to a lot of possibilities. That it just doesn't have to do with being a child. There's so many things involved in that, and that also has to do with my discussion. I wish I probably could have been more extensive about it, but this would have been a very inflated presentation. Alright, so in my project, I'm putting more emphasis on anxiety in children when they go to the dentist or the pediatrician. Suggestions for future areas of study can include teenagers, adults, and dentists. So basically what I was thinking is that maybe I could have done more surveys, not just for children, but I could have done when they turn into older teenagers or when they go into adulthood. Dentists could be involved because you want to know how they're feeling for the kids. I mean, if a kid is yelling, you don't think the dentist is going to be, the dentist isn't just going to be on there all relaxed and calm and collected. They're going to have feelings towards too. And what Daniela had suggested was that there's proper techniques and things that they are taught in order to deal with children. But even at that, everybody's human. So, and dentists can be involved because it's important to see how they feel with patients and what they do to make experiences more enjoyable and smooth. Right? And the strengths of my study is that you can see how children are feeling about the topic. And the reason why I chose a specific population, I could have gone to ages 3. That's when that's the usual time where a child can talk. But I wanted them to be from 7 to 14 because you want them, if a child is saying, okay, I'm scared, you want to know why. You can ask them when they're between 7 and 14, why are you scared? Explain to me. And that's why I chose that specific population. The limitations could be that I do not represent all possible variables, such as the dentist, teenagers, adults, big income levels, the race, the gender. Okay, this is my survey. So basically, I try to make this as simple as I could that a child of that age would understand. I had come up with other surveys prior to this, and when I thought to myself, if I was a 7, put myself in that person's shoes, could I understand it? And I did a draft, and this is what I came to, and I made it short and simple, so and so I don't want them to feel pressure. I didn't want them to feel like this was, stressful. I want them to be relaxed and a smooth process. Okay, my relative risk. So the 2 questions that I chose were whether children were anxious of dental office, whether they weren't, and how many visits they had to the dental office. And this is really important because, and this has to do with parents also. If you don't go to the dentist, probably because you may be scared. Well, that's another thing too. That's kind of a handicap. You never get the experience, and this is really bad because if you never really get the experience, then you won't know whether or not you feel uncomfortable or you don't. And again, it affects your oral health. And I found that I feel like I had mixed results, and I couldn't put it on one variable. I felt that these results means that most people that were scared of going to the dentist had fewer visits. However, the people that were not scared still had some people that did not go to the dentist. So as you can see, some people who were not scared, there were still a couple or a few that did not go. And this is important to think because maybe there's other variables, like I said, that contribute to it. Maybe their parents don't feel that they don't have the money to do that. Maybe insurance has something to do with that. So the child is not the only person that has the decision whether or not to go to the dentist or not. Okay, 3 citations, and this is what I was talking about Miss Meissner which kind of helped me find this research, was that when I'm talking about how childhood experiences with the dentist can follow them throughout the rest of their life, she had put in an abstract saying, what proof do I have of that? And I didn't have any proof. I researched dental anxiety, so I kind of stretched things a bit, and I went to childhood traumatic experiences. And it suggests that traumatic experiences affects children's mental, social, and physical health. Also, these experiences affect how the brain develops over time, and that's really important, and that's a statement, and that's the basic overall summary of what I'm trying to get at, is that, and it also includes dentistry, about if you're so dead scared about going to the dentist, it develops. That's how your mind develops. When you're thinking about, I should get my teeth fixed, or I should get them looked at, your brain is telling you 2 different things. I should do this and should I not? And that's really important. Another article that I